Hi, my name is Christina and this is a how-to video on how to stay healthy as an adult, i.e. what you should keep in your medicine cabinet. I have a lot of personal experience with this because my dad is a physician and he has always made sure that our medicine cabinet is well stocked with everything that we need to solve any sort of minor problems. So I've learned a lot from him on how to just take care of little things here and there. This is especially important for anyone who is living on their own or just away from their parents for the first time, because life doesn't stop for being sick. Even when I'm sick, I still have to do laundry and go to class and get work done and all that stuff. So it's good to just have everything you need on hand to try to help yourself feel a little bit better. So I'm going to start off with 3 major tips. The biggest tip I can give is to buy generic. My dad told me this a long time ago, and we've been doing that in our family for years and years and years. Because when it comes to medications, most of the time there is really not a major difference between brand name and generic so long as they have the same active ingredients. So that's what you really need to look for. You want to look on that little facts panel and look for active ingredients. The second tip is to either write or circle or put a sticker on whatever the expiration date, because medications and creams and stuff do expire, and so it's important that you keep track of that so that you're not using an expired medication, because that could cause more problems than the amount of problems it solves. My third tip is to make sure you have all your medications in one place. So I have this handy bag that I have everything in. You probably need to keep it really just in the cabinet or anything. You just don't want it out in the window where the sun's going to be down on it, because intense heat or intense cold can affect the efficacy of your medications. So I'm going to start out by just going over medications that help the different problems you might experience. Now first is pain. Pain is the most common problem we might deal with whenever we don't feel well. Now probably one of the most common pain relievers is aspirin. I don't have that with me because I'm not supposed to take it for health reasons, but that is definitely a very common one. The only thing you've got to be careful with is aspirin can irritate the stomach and it can cause problems if you're taking blood thinners. So the reason I can't take it is because I've had problems with low platelets before, and aspirin actually works against platelet action. So if you either have low platelets or you are taking blood thinners, aspirin can make the problem worse. So definitely be careful with that. So what I take instead is Tylenol or acetaminophen, probably the most common pain/fever reducer that people use. So Tylenol may be a big red pill, but this one is just white. I just look for acetaminophen. This is regular strength. You can really change the strength by increasing the dosage, but of course, pay attention to what it says on here and don't go over the maximum dosage recommended here. So I definitely have that. Another common pain/fever reducer is ibuprofen, which is Motrin or Advil. Again, I don't use that because I have just always used Tylenol. And this next one, Aleve or naproxen sodium. Again, all of these work to reduce pain and fever, so you just kind of gotta know what works for you. And so here is my Aleve, naproxen sodium. This is normally a little blue pill. And I'm going to show you what the pills look like, because it is a good idea just know in general what medication looks like, just because you might be tired or you might not be paying attention, but you want to know what your pill looks like, that way you don't take the wrong one. So that's why I just kind of want to show you a little bit. So the next thing is if you have a cough or allergies or anything like that. If you're experiencing any sort of congestion, so you have a lot of sinus pressure or your nose is stuffed up, you'll want a decongestant. And the most common one is phenylephrine, HCl, which is found in Sudafed. And I'll just go and show you. They usually come in little rows like this. They're little red pills. Now this one, Sudafed is a special case because Sudafed also sometimes has pseudoephedrine, and This medication is now held behind the pharmacy counter, and you have to actually show your ID to get it because it can be used to make certain types of illegal drugs. So this one is brand name, or is generic, and doesn't have pseudoephedrine, so I didn't have to worry about showing my ID or anything like that, and it still works well. It is still decongestant. The second thing you might get is a cough. So I had this a couple weeks ago and had the fun experience of dealing with a really bad case of bronchitis. So oftentimes with colds and coughs, you'll see these bundle medications that have several ingredients in it. So I use Mucinex, and I'll just kind of point out some of the active ingredients within this. So first of all, this one is a little different because it has daytime and nighttime, and I'll just kind of point out what is different. The daytime has more ingredients because that's when you're trying to do more things, you're exerting your body more, so you really gotta give your body a little bit more help during the day. So the first thing is, if you have a dry hacking cough, or really if you're just coughing way more than is practical for carrying on with everyday life, you'll want a cough suppressant. So the most common one is dextromethorphan, HBr. And then if you have mucus in your throat, which you'll probably be able to tell, you can feel if there's stuff in your throat, you'll want an expectorant. An expectorant will help loosen the secretion so you can cough them out. Now I know this seems kind of gross, but the mucus has basically all the bad guys, all the bad cells that are making you feel bad. So the important thing is to get them out as quickly as possible. So the most common expectorant is guaifenesin, and then this one also has phenylephrine just as a nasal decongestant, just again help them with congestion and general discomfort that it can cause. Now the main difference between the daytime and the nighttime is the substitution of diphenhydramine, so the antihistamine. So if you have allergies and things like that, you might take Benadryl, which is the main medication that has diphenhydramine. The thing you have to be careful with is that it can cause you to be drowsy, and so you don't want to take this during the day and start to feel sleepy when you have 5 hours of work to do or stuff like that. So that's why this is in the nighttime version of the Mucinex pill. If you still do need a strong antihistamine, you can also use Claritin. Claritin is a non-drowsy antihistamine that you can make use of. The next thing I need to talk about are stomach issues. We've all had something bad to eat, or just gotten the stomach flu from one of our friends or roommates, and so I have some things here to take care of that. So first of all, when your stomach's not feeling well, when you're had heartburn or acid reflux, or temporary acid reflux, then you want antacids. And so I don't have any on hand, so I just got some from my roommate who is Ray's health advisor. And so this one is a little white pill, but Tums is probably one of the most common antacids. They come in all sorts of fun flavors, and this helps counteract the acidity of your stomach and helps relieve some of that discomfort. So I have a few of those pills. If you want something a little bit stronger, you can go for Prevacid. This actually used to be a prescription medication, but now they sell it over the counter. And the medication name for this is lansoprazole. And then the other fun topic that no one likes to talk about, diarrhea. So I have an anti-diarrhea medication, and this is really for symptoms that are more than 24 hours. So if you eat something bad and you feel bad the rest of the evening, but you feel fine the next day, then you can really just let your body take care of itself. But if you've got a stomach infection and you're feeling bad for more than 24 or 48 hours, then you might want to make use of this. The main ingredient in here is loperamide, and I can show you what they look like. The brand name for this is Imodium, which are usually little green pills like this. That's never fun. Now the next thing we're going to go over are creams to solve skin problems. Now I don't have one of these with me, but probably the most important skin cream to have is hydrocortisone. This can help with bug bites, rashes, all sorts of stuff. So that's hydrocortisone 1%. Always a good thing to have on hand. Because I live in Houston, a very humid city, and mosquitoes are all around, I have itch relief cream. Because when I get mosquito bites, they get really itchy. So the main ingredient here is diphenhydramine, which, if you remember, is an antihistamine that was found in Benadryl. So I definitely have this. I sometimes carry it around me when I have bug bites because they can be really uncomfortable. Another thing you can have is an antifungal cream. This is called Jock Itch Relief, but it can really treat any sort of fungal infection. So if you have athlete's foot or anything like that, this can treat that. And the main ingredient in here is clotrimazole. So I don't have that. I haven't really had problems with that, but you never know. And then if you have any sort of cuts or scrapes or anything, it's good to have an antibiotic ointment cream. I usually have 3 main ingredients, and so this one has neomycin sulfate, polymycin B-sulfate, and pramoxine. So if you have any sort of scrape or cut or anything like that, make sure to have this on your cut after you've cleaned it, of course, to help the healing process as much as possible. On that same note, you should have Band-Aids. So I have some in a little mini first aid kit right here. So it's good to have Band-Aids of all sorts of sizes because you don't know what kind of cut you're going to get, what size it'll be. So these are little round ones. This first aid kit also has little antiseptic wipes. So whenever you're dealing with this cut or scrape, you really want to make sure that the area around it is clean and your hands are clean because you don't want any more germs or anything getting into that cut. I also have gauze here, which is helpful for maybe a little bit bigger abrasion, but this you would need medical tape to secure. And finally, because we all get sunburned sometimes, I have aloe vera gel. So this is very helpful last summer when I worked at summer camp and I got a really bad sunburn. This really helps to hydrate the skin after you get a sunburn, and because that's really what it is your skin is devoid of moisture. That's what the burn does. So the important thing is to keep hydrating that skin and then just protect it from future sunburn. And of course, one last thing is a thermometer. So whenever you feel sick and you feel like you might have a fever, it's important to have a thermometer so you can keep track of it and see how it changes over time. So if you have a really high fever that's lasting for days and days, then you might need to go to the doctor. So it's good to just be able to keep track of that. So that is it. Of course, if you feel bad for several days or more than a couple weeks on end, you should go see a doctor, but this is good to have just to solve any sort of minor problems that you might have. So I hope you enjoyed this video. Bye.